Hi guys, so Boris Johnson gave an update on the current status of the pandemic in the UK. So let's hear what he had to say.
4,786,219 tests for coronavirus have now been carried out or posted out in the UK, including 171,829 tests yesterday. 279,856 people have tested positive, and that's an increase of 1,871 cases since yesterday.
Okay, the last data I looked at, it was 1,600 new cases. Now you're talking about 1,800 new cases. So the number of new cases are increasing. So why the hell are you easing the lockdown?
7,485 people are in hospital with COVID-19 in the UK, down 16% from 8,921 this time last week. And sadly, of those who tested positive for coronavirus across all settings, 39,728 have now died. That's an increase of 359 fatalities since yesterday, and once again, we're with their families in mourning.
359 people have died, and you're still talking about easing the lockdown. You've already began to ease the lockdown. You have 1,800 new cases and 350 deaths. Why the hell are you easing the lockdown? This is not the time to do it. What we're going to see is we're going to see a delay. So the lockdown has been eased. People are starting to eliminate and forget about social distancing. And you're going to see, probably in a week or 10 days, a spike. So what are you going to do about that?
Now that the rate of transmission in the UK has fallen significantly from its peak, we need to take steps to manage the flare-ups and stop the virus from re-emerging. I want to update you on the progress we're making on 3 fronts to prevent a second wave of infections that could overwhelm the NHS. First, we've set up NHS Test and Trace in order to identify, contain and control the virus in the UK, thereby reducing its spread.
Why are you calling it NHS Test and Trace? It's not an NHS Test and Trace system. It's a private company that is carrying out this testing system. Boris Johnson is connecting the name NHS with it because it gives it legitimacy. But it's not legitimate. It's a private. Maybe I'm being overly critical here. Maybe it's not that it's not legitimate, but you shouldn't be calling it the NHS Test and Trace system because it's not run by the NHS. The NHS has very limited input.
As we move to the next stage of our fight against coronavirus, we'll be able to replace national lockdowns with individual isolation and, if necessary, local action where there are outbreaks.
And how the hell would that work? So, for example, if there is an outbreak in Manchester, does that mean people from Stockport or people from Wigan can't get into Manchester? Manchester is closed. Can people who are in Manchester and there's an outbreak in Manchester, can they leave? Can they visit other towns? Are there going to be roadblocks on around towns that have a spike in cases? How are you going to implement this? How are you going to control people moving in and out? If there's no lockdown in one town and there is a lockdown in another town, how are you going to stop people from moving from one to the other? Are you going to have roadblocks? Are you going to have security checks? How many security checks are you going to have? Are you going to surround an entire town? This is an attempt to avoid a second lockdown. If there's if there are spiking cases in Manchester, for example, okay, we'll deal with Manchester. But this is all a facade. It's about let's give the image that we're doing something when we're not doing something.
NHS Test and Trace will be vital to controlling the spread of the virus. It's how we will be able to protect our friends and family from infection and protect our NHS. And it does this by identifying anyone who's been in close contact with someone who's tested positive.
I'm not against this test and trace system, but why are you implementing it when you have ended the lockdown, basically? This should have been before a lockdown. This should have been at least at the beginning of a lockdown. You're ending the lockdown, and now you're implementing a test and trace system. This should have been done weeks ago at the latest, and months ago at the best.
Asking them to isolate for 14 days in order to avoid unknowingly infecting others. And the system.
And who's going to check whether these people have isolated? Once again, there's no teeth. There's no mechanism to reinforce any of this.
The system clearly relies on everyone playing their part.
And once again, Boris Johnson is dumping the responsibility onto the public. Please self-isolate. Please don't do X. Please do Y. Please, we need you to do it because we can't do it.
So I want to stress again today, we need you to get a test if you have coronavirus symptoms, a high temperature, a new continuous cough, or a loss of taste or smell. There is plenty of capacity, and everyone with symptoms is eligible. Everyone with symptoms. So please.
Shouldn't it be? I'm not trying to punch holes in or pick holes in this, but it would be better. Anyone who wants a test, irrespective of symptoms, will be given a test or shall be given a test. This is an improvement over what came before. I really hope he's telling the truth here, that people can actually get tests. Waiting for symptoms is better than nothing. It would be better to isolate people even when they're asymptomatic. There are a number of days where people are asymptomatic. Of course, you would need to test the population irrespective of symptoms, which would be better. But at least if they're testing people who have symptoms, making tests available, that's a huge improvement over what was coming before. But social distancing and a lockdown help testing and tracing. They work in unison. But what you're doing instead is you're ending the lockdown and then you're attempting to replace it with testing and tracing, which is not the approach that the WHO talk about, or many of the scientists who were originally advising Boris Johnson have come out against it.
Please order a test from nhs.uk/coronavirus as soon as you develop symptoms. And we need you to isolate yourself if a contact tracer tells you that you have been in contact with someone who's tested positive.
And what if people don't? Are they going to be punished? Is there going to be a fine?
NHS Test and Trace started operating a week ago, and already thousands of people are isolating who wouldn't have been doing so before this service was introduced. And they are thereby protecting others and reducing the spread of the virus. So while we're going to all these efforts here in the UK to control the virus, we must also ensure we don't re-import the virus from abroad.
So now he's going to talk about quarantines, which once again are way, way too late.
So the second action I want to update you on is the introduction of public health measures at the border. Today, the Home Secretary has brought forward the legislation needed to establish the new regime from Monday. And I want to explain the reasons for introducing these measures now.
Once again, by Monday, everything is like a week in advance. Okay, today is Thursday. When this was brought, why not introduce it immediately? Tomorrow? Why is it we'll wait for another few days? Why are you implementing this now? Why wasn't it implemented during the beginning of the lockdown?
When coronavirus started to spread around the world, first from Wuhan and then from northern Italy and other areas, we introduced enhanced monitoring at the border in an attempt to stop the virus from gaining a foothold in the UK. These measures applied at various different times to arrivals from China, Japan, Iran, and Italy, and required people with symptoms travelling from those countries to self-isolate for 14 days.
No, the people were given a form and said, please self-isolate for 14 days. There was no check carried out, so many people arrived. People were coming from Madrid to watch football matches at the beginning of the lockdown, but before the lockdown was implemented. Many other countries had gone into lockdown, and the UK was still open. People were coming over for football matches. I remember people coming from the Republic of Ireland to watch horse racing at Cheltenham. And I remember speaking to relatives on the phone, and, you know, in an angry manner, I was talking about why are these people travelling from Ireland to the UK when they should be staying in Ireland. They should be helping to stop the spread of this virus. I read a story about a paramedic who contracted COVID-19 at Cheltenham, and he brought it back and he infected a number of people in Ireland.
However, once community transmission was widespread within the UK, cases from abroad made up a tiny proportion of the total.
So this is the excuse. So the numbers, we were focusing too much on cases within the UK to bother implementing a quarantine for people coming into the UK.
At the same time, you'll remember that international travel plummeted as countries around the world went into lockdown. So as a result, measures at the border were halted because they made little difference at the time.
They were laxed. They were lax at the border. We decided not to implement any checks. We just let people, the number of people coming in was greatly reduced. Yes, he's correct here. The number of flights, and I made a video about it. I showed the number of flights between Italy and the UK at the time was greatly reduced. It was not zero, but it was greatly reduced. But you don't need a huge number of people in order to transmit the virus. You only need one person to be able to transmit it at that time to 3 others, and then that, of course, works out. You have 3 people infecting another 3 each, and then you can do the mathematics. Don't rely on me, of course. You can see how it's going to spread very quickly. But Boris Johnson's response is, we didn't implement any legislation to stop, to quarantine people at the border because it wasn't a concern for us. The numbers were too low, so we didn't even bother. Why? If it doesn't cost you anything, it's just you have a majority. It's not like you had to fight to get this, and it would have been a political struggle. You had a majority. You could have implemented this with the stroke of a pen. You are the government. You can do this. But you decided not to. Of course, it was a political decision once again. It was not a decision based on health or as they quote, the science.
In our fight against the virus. Now that we're getting the virus under control in the UK, there is a risk that cases from abroad begin once again to make up a greater proportion of overall cases. We therefore need to take steps now to manage that risk of these imported cases triggering a second peak.
Once again, this makes absolutely no sense. The number of cases were low, yes. Now that you have decided, well, we've reopened the economy and we've reopened society, now we're going to focus our attention on some people arriving via airports or ports, but we're not going to we're not going to enforce it on everyone. Some countries are going to be exempt. For example, the Republic of Ireland is going to be exempt, which makes absolutely no sense. Someone could fly into the Republic of Ireland from a country that the UK has allegedly excluded, and then travel by train to Belfast and then cross from Belfast into Great Britain and carry the virus with them, and they wouldn't be asked to quarantine.
So just as we're asking people already in the UK to isolate for 14 days when contacted by NHS Test and Trace, we're also...
Stop calling it NHS Test and Trace. It's not NHS Test and Trace. It's a private company that you have hired to do this.
Asking those arriving from abroad to isolate so that they don't unknowingly spread the virus. And there will be some exemptions.
There we go.
For a limited number of people who need to cross the border, such as those engaged directly in the fight against coronavirus or who provide essential services. And
he's not talking about the countries that are excluded, for example, the Republic of Ireland. Why is the Republic of Ireland excluded from this? Irish people are not immune to this. Why are you excluding the Republic of Ireland? This is about putting the emphasis on trade, on the economy. It's putting the economy before public health. Otherwise, you would have had a quarantine from the very beginning. You could have done it. You're doing it now. You're saying we're going to do it on Monday. And it's more difficult actually to do it now because you have larger numbers coming into the country. It would have been much easier to do it at the beginning of the lockdown, where the numbers were much smaller. And just implement it then, and then monitor it. And then if you decide later, maybe at the end of this year or in September, you could say now it's time to gradually ease this quarantine. But instead you did the opposite. You didn't implement the quarantine correctly, and now you're attempting to do it.
We will review how the policy is working after 3 weeks. And of course, we will explore the possibility of international travel corridors with countries that have low rates of infection, but only when the evidence shows that it is safe to do so.
So what he's talking about here is these travel corridors is where certain countries will be exempt. So at the minute, the Republic of Ireland, but he's talking about, well, maybe we could allow people coming from Japan or people coming from Sweden or people coming from the United States. They are exempt. But if somebody arrives in, for example, Sweden from another country, are they exempt as well? If they're flying, if their connection is in Sweden or in one of these travel corridor countries, are they exempt as well? He doesn't go into details, of course.
The third point I want to make today is we need effective international action to reduce the impact of the virus across the globe. And this is the moment, really, for humanity to unite.
He's talking about uniting. This is the time for humanity to unite. You know, the European Union gave us the possibility to buy PPE and ventilators at the beginning of this crisis, but we didn't want to unite with the European Union in order to deal with this crisis. We decided, no, we are like an empire. We don't need other people. We can do it all by ourselves. And unfortunately, almost 40,000 people at the moment of this video recording have died, but at least we did it by ourselves. We used that bulldog Brexit spirit, not listening to foreigners, not listening to the European Union, doing it on our own. Okay, we killed almost 40,000 people in the process, but at least they died as free people, not under the European Union boot. Sorry to be so sarcastic about this, but what else can we say?
Fight against the disease. Health experts have warned that if coronavirus is left to spread in developing countries, that could lead to future waves of infection coming back and reaching the UK. While our amazing NHS has been there for everyone in this country who needs it, many developing countries have healthcare systems which are ill prepared to manage this pandemic. So, to ensure that the world's poorest countries have the support they need to slow the spread of the virus, tomorrow I will open the Global Vaccine Summit, hosted by the UK, and we'll bring together more than 50 countries and leading figures like Bill Gates to raise at least $7.4 billion for Gavi, the Vaccine Alliance.
Okay, but I uploaded another video where Michael Gove was talking about, well, let's not be part of the European Union anymore. Let's not extend the transition period, because we might have to pay maybe 4 or 9 billion pounds to the European Union. Now, we could actually spend that money on the NHS, if you believe he actually said such a thing. Now Boris Johnson is talking about, let's raise some money for countries outside the UK. This doesn't make any sense to me. Of course, what he's saying would be a good idea, but it doesn't make any sense in the Brexit mindset.
Over the next 5 years, with the UK's support as Gavi's biggest donor, this vaccine alliance aims to immunise a further 300 million children in the poorest countries against deadly diseases like polio, typhoid and measles, again, saving millions of lives. This support for routine immunisations will shore up poorer countries' healthcare systems to deal with coronavirus and so help to stop the global spread and, as I say, prevent a second wave of the virus reaching the UK.
I don't really think you should promote this type of thing, Boris, because the people who voted for you in December and many Brexiteers are very much against the idea of vaccines.
This virus has shown how connected we are. We're fighting an invisible enemy, and no one is safe, frankly, until we're all safe. And again, of course, this is all contingent upon each of us continuing to do our bit. And as I never tire of telling you, let us not forget the basics. Wash your hands regularly and for 20 seconds. Wash your hands. Do not gather in groups of more than 6 outside. Always observe social distancing, keeping 2 meters apart from anyone outside your household. And I want to stress...
I wish he'd also include masks here. It would be important for people to wear masks so that they don't spread it, spread the vapors if they're infected. Once again, I think it would be good for him to wear a mask. You know, right beside him, as he walked in the door, he could have his mask on, take it off, give his speech, put it back on again, and then leave. He could have some hand sanitizer next to the door as he enters, just to reinforce the idea in people's minds that it's important. If people don't see the Prime Minister doing it, I think people sort of ignore it.
That's one final point which may be relevant today as the weather threatens, I think, to take a turn for the worse. Some of you may be tempted to move the gatherings you've been enjoying outdoors, indoors, out of the rain. I really urge you, don't do that. We relaxed the rules on meeting outside for a very specific reason, because the evidence shows that the risks of transmission are much lower outdoors, And the risks of passing on the virus are significantly higher indoors, which is why gatherings inside other people's homes are still prohibited.
But people in the comment section on this channel have talked about how, okay, but can I use someone's toilet? What if I need to go, in the garden, if I need to go and get a beer and there's someone in the kitchen, can I enter or not? You could write it down, you could mark it down as common sense, but allowing people to congregate is a bad idea, especially when you have such a high infection rate. You have 1,800 new cases and 350 odd deaths. It's still too high, Boris.
These rules now could undermine and reverse all the progress that we've made together. I've no doubt that won't happen. I think the British public will continue to show the same resolve in fighting the virus as they have throughout this outbreak. We will get...
And once again, he's dumping the responsibility onto the public. I'm sure they will respect the rules. The the number of new cases, as I've said before, are increasing. So why are you not doing something about that? You're talking about testing and tracing, okay, but you're not enforcing the rules. You're not handing out fines. You're not putting a brake on the easing of the lockdown. You're talking about let's move on to the next phase. Not in this video, but he has talked about it before. Yes, we're on target. How is this being on target? You have 1,800 new cases and 356 deaths. How is that being on target? And of course, these are the official deaths. So we can, of course, add a huge number of deaths that are not registered. People in care homes, I don't know if they have been included or not, but also people who die in the community who haven't received a test. They're not included in these numbers. Anyway, guys, let me know what you think in the comments. As always, they're greatly appreciated. Thanks. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun? If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.